We're going to head over to the CNMI where Tomas Manglona joins us. Good morning, Tomas.
Good morning. I don't even know what I walked into this morning.
I know.
It's a fun time. It's a fun time.
And a busy time.
And a busy time. No, yeah, you're right, Brie. Just starting off with some of the latest COVID data that we received last night here in the CNMI. 11 active hospitalizations. The Commonwealth Healthcare is reporting. Of those hospitalizations, 3 are unvaccinated, 8 are vaccinated, and unfortunately, one patient is on a ventilator. But they also report 181 new cases, of which 16 were identified on Tinian. And Bree, later tonight, we're going to have an update with regards to testing. I know earlier in the week, we ran a story on some issues with the South Korea Solgent test kits and testing platforms. So we're going to bring you that. We're expected the latest data from the Commonwealth Healthcare Corporation. But before then, we also wanted to show this clip of the Commonwealth Healthcare Corporation CEO, Esther Munya, explaining the need for a new hospital. Their FEMA Region 9 is expected to visit the island around February 28 at the end of this month to assess the current hospital and see what facilities are needed. And to put into perspective, because we have been reporting and we've reported from the alternate care site, which is at Kanoa Resort. However, that alternate care site is in a different part of the island, separate from the hospital. And so while the health officials say that they're fortunate that we have this alternate care site, which has extra beds and the facilities, they've essentially had to renovate a hotel for the use of patients, which the CEO says is basically unacceptable in terms of having to address a public health crisis. And one thing that they're talking about as well is that while we're still dealing with COVID-19 and this pandemic, there's going to be another infectious disease. We don't know when, we don't know how, but they're wanting to anticipate that and make sure that all the healthcare officials have what they need to address this ongoing pandemic, but also possibly, unfortunately, future health crisis as well. So this is Esther Munya explaining the need for that hospital.
Okay.
And how we can utilize the current funding, the federal funding, to really move us in that direction, whether that be a state-of-the-art hospital or systems in place to respond to major pandemics like this. What are we doing about it?
Can I start? So we want to have control, right? We want to acknowledge that that control could also get us back to crisis again, right? So we need to acknowledge uncertainty about the future, right? We know that we can't predict it. I mean, like you mentioned about the new Omicron variant. What we're trying to do here is empowering our people, empowering them to take appropriate actions, right? So let them know that, if you're positive, if you're a close contact of someone, test on day 5. That's basically when you would know. Some people test too early. That's one thing that we notice individuals do also. So test on day 5, you're a close contact. If you're symptomatic, you can get tests, and it has to be the right test. And that will be the antigen test, because you would find that current infection. So we want to again empower people. That's one thing. We've been putting out the messaging about living COVID safe. We talked about mitigation, about making sure that our hospital. I like that you brought that up, because I did have a conversation with HHS a couple of weeks ago. And, when are we going to start thinking about building another hospital? Because, like I mentioned earlier about our resources, how can this be okay to have to separate our resources, putting in one area far away, by the way, it's not even close. And so, and have it also at the hospital. If it's the same people doing the services from monoclonal antibodies, nursing, treatment, and even, to the public health education, we need to be in one centralized place to be able to be more efficient, I guess, if you want to say that, but also to be able to reduce some of the stress that the staff are experiencing. And it's one of the things that I discuss with my staff about, how can I retain them, right? I mean, they're obviously tired, and how do I make sure that we provide them the time to stress out? I mean, to get the stress out of their system. It's been difficult, I'll tell you. So we know that we need to build, yes, definitely we need to build another hospital. So I was so happy when the Region 9 administrator contacted me and said, hey, we're going to be there, we're going to do an assessment. And my answer to him was, it's about time, because we did discuss this early in the stage, right? When FEMA, back in 2020, about, we're always going to be the only players in town. We're always going to be the people that are probably going to be addressing and treating people. And yet, as much as I appreciate the fact that we have a different location, I really wish it would have been just one location. But it worked. It worked with what we could do now, because they said they couldn't build, but they can definitely help with renovation of another facility. So we just have to accept that. And so, but moving forward, who's to know what infectious disease comes again? And and you're right, we need to start planning. So yes, part of our planning is looking for mitigation measures. We're basically putting all kinds of air cleaners in throughout the hospital facility.
All right, and so again, that was the CEO Esther Muña. First, we're hearing of that call for a new hospital or better conditions given the stress of the pandemic. Just did also want to shift gears a little bit. Yesterday, we reported on CNMI Governor Torres and the CNMI government overall spending about $121,000 in legal fees for legal representation for about 12 witnesses, including the CNMI governor in the legislative committee hearings that led up to ultimately his impeachment in the House. Late yesterday, the CNMI governor released a statement defending the government spending of about, again, $121,000 in legal fees for representation throughout those legislative proceedings. He said, quote, "Everyone has a right to counsel, most especially CNMI government employees who are hauled in to testify before the committee hearings. All these employees, including myself, were served with a subpoena," he said. And he also explained that the employees who were called by the legislative committee, they sought legal representation by the Attorney General, Ed Manabusan, but because he's the Attorney General and due to a conflict of interest, they went ahead and sought these private attorneys. And the Attorney General ultimately, the governor says, signed off on those hirings. Governor Torres added, quote, "This was particularly true in the matter concerning my own legal representation," he says, "in my official capacity as governor. It was essential that I receive representation by an attorney, including expert attorneys in this subject matter, as the setting, format, and lines of questioning asked across our branches of government contradict the separations of power clause." He concluded, "At the end of the day, the committee is to blame for these private attorney expenses." And so the back and forth, the word of war continues between the legislative and executive branch. Bree, today we were expecting to hear from the Joint Senate Committee that's tasked with drafting the impeachment rules that would set the parameters in terms of who would be the House impeachment managers, the prosecutors essentially from the House, who would be the presiding person for that, whether that's a former judge or a former senator. But yesterday we reached out to Senate President Jude Hofschneider. He said those rules are not expected to come out today, not yet. We're waiting to see, of course, once those rules are out, then the process is in motion to schedule the Senate impeachment trial. It's unclear if that's going to happen the next week after the rules are out, or if it's going to happen in the next month, or maybe even more than that. So that's some of the latest that we're reporting on. And today, what you can expect is the ethics committee that is newly formed in the House will be meeting today to for the first time, discuss in public view some of the ethics complaints against some legislators. They didn't express explicitly what that is, but based on our reporting, we know that this ethics committee was formed because of the sexual abuse allegations with regards to one particular legislature, Congressman Ed Probst. And we know that they're going to be at least looking at 2 different complaints. The other is anticipated to be about some of the remarks and one senior official in the government saying that Ed Probst threatened him in a Facebook Live video that he did. So that's happening around after lunch today, and we'll bring you that. This is the first time this ethics committee had to be newly formed, and this is the first time they're going to be talking about specific complaints today.
It sounds like you got an extremely busy day.
Yes, no shortage of news outside of the CNMI and on Tinian and Rhoda as well. So looking forward to bringing you the stories as they come.
Mm-hmm. I did want to follow up on the hospital and the hope to build a new one. You know, here on Guam, we had the U.S. Army Corps of Engineers. They came out here, I think it was in 2019, and they did a complete assessment of GMH, and they found so many problems with it, right? And so the idea was, we're not going to dump all that money into fixing GMH. Instead, we might as well build a new one because it's more cost effective that way. And so has the U.S. Army Corps of Engineer done any sort of similar assessment over there at of the CHCC?
I'm not sure what has happened in the past. As you heard in the legislative hearing when Region 9 called Esther Muña, and they said that they want to do this assessment, she said it's about time.
Yeah.
And again, with the alternate care site, you know, everyone's grateful that it was built, it's being utilized, but it does, in a way, both figuratively and literally stretch the resources because it's separate from the actual CNMI hospital. It's not even, you know, close by. And so that's what they're looking at. And we asked for more details in terms of who exactly is going to be visiting at the end of this month. And so we'll see. This is the first time again that we were hearing about it. And we know that Homeland Security, FEMA, they're going to be here at the end of the month. FEMA executives, we were told by the Public Health PIO Guild of Foy that it's going to be Homeland Security and those FEMA executives who will be possibly signing off on the assessment, which will be done by the U.S. Army Corps of Engineers. And so this was the first we heard of it. And tomorrow, hopefully we'll get a chance in the morning at the weekly press conference to ask more about it and whether or not this is going to be an ARPA project or not, and whether or not this is something Governor Torres sees that is going to be a priority, if not for the remainder of his term, if he's reelected for the next 4 years of his term. So we'll see.
Has there been any indication that it is a priority, or you haven't heard anything at all? I mean,
No,
we kind of already, we knew from the jump that this was a priority of Governor Leon Guerrero. I mean, it was clear that she was going to set aside X amount of hundreds of millions of dollars for a new hospital complex here on Guam. But I'm just wondering, in the spending plans that Governor Torres has issued, was there anything in there indicating that, okay, we're going to build a new hospital or something kind of similar?
No, at least not that I'm aware of. I do know that when he first released his ARPA plan, there were major, commitments to infrastructure. But other than the basic commitments to, broadband, water, and all of the basic infrastructure, big topics, we haven't yet heard specifically on this particular commitment. But we do know that early on that the commitment to the alternate care site and the money that went into that was definitely a major part of the pandemic response. We were there when it first opened. Yeah. We were there when it was being used, and we were there when FEMA went to assist them in the administering of the monoclonal antibody treatment. And so I don't know. I think if you look at it at face value, you wouldn't be wanting to run your hospital from a hotel for the rest of, eternity, for the future here in the CNMI. And also to put in perspective, I think oftentimes people might not know that the only hospital is here on Saipan. Tinian and Rhoda has healthcare centers, which, can provide some treatment, but it's not a hospital. And so and when the pandemic broke out in Rhoda and Tinian, that was one of the major concerns, even in terms of quarantine facilities. When something happens, Saipan, the questions always rise about what about Rhoda and Tinian, and what does the response look like there? Because is it practical to always fly people over, especially if it's an infectious disease that spreads through close contact? And what are the logistics around that? And early on, when the airlines were down during my last trip here around December, some of those COVID positive people were transported by boat, right? And so further just underscoring the need for this conversation, and we'll continue to ask because we have not yet heard the priorities with regards to this new development and the visit that will be happening in a few weeks.
So the alternate care facility that's at the hotel, that was funded through FEMA, I would assume, right? Do you remember how much they gave for this ACF, and it's only supposed to be temporary?
Yeah, it's only supposed to be temporary. The figure's not coming to mind right now, but it's only temporary. And as we reported, the pharmacy, they are running a pharmacy out of there as well with regards to the COVID therapeutics. And moving forward, Kanoa, which is where the alternate care site is going to be practically the only quarantine and isolation facility. They're phasing out the other facilities. There isn't any facility on Tinian. They phased that out. The Rhoda facility is still seeing some folks who want to be quarantined or isolated. And PIC is phasing out its last travelers. We're being told that this week, once travelers leave the PIC hotel, that's going to be phased out. And so, we're going to see Kanoa definitely be used for the remainder of at least COVID. But there is some time to consider, that new facility that the CEO requested that they have.
All right. Thanks a lot, Tomas. Is the governor holding a press conference, the weekly press conference tomorrow?
That's what we hear and expect every Friday. So hopefully that happens. And again, this big news, and we want to know whether or not this hospital is a dream or if it's going to become a reality for people here in the CNMI.
All right. Thanks a lot, Tomas.
All right. Thanks, guys.
All right. Talk to you later. Just something, this whole alternate care facility, we actually got money from FEMA. I can't remember, it was $15 or $17 million for the skilled nursing facility. We got all this money to convert it to an alternate care facility. I think we've checked in with GMH a few times since the pandemic. And actually, I'm not sure where we are with that. So we'll certainly get an update, because I'd be interested to see, how far along they've come in using